sitting where you do within the fertility ecosystem at Ovation, you kind of have visibility into a broad spectrum of kind of the components, the various kind of ancillary services around fertility. When you look out today, what are some of the biggest challenges that women and families face in their fertility journey?
Yeah, I think the biggest factor and barrier that we're facing is just access. And a lot of that comes with affordability. And there's just a ton we can do and have done when it comes to affordability. And affordability drives access. The great thing is that by improving success rates, we're actually giving people a child, and hopefully a healthy child, faster, which is really satisfying and ultimately what they want, but you're also reducing costs. So if we can minimize either the number of cycles or the total time it takes to have a healthy child, we're actually reducing costs and improving outcomes. So it's kind of really double whammy. And we've spent an inordinate amount of time figuring out how do we improve success rates, and feel like our live birth outcomes are significantly better than the national average. We have more frozen embryo transfers than the national average, and it speaks to the best practices. And we use PGT, which is genetic testing, much more than the national average. We think all those things add up to having a healthy baby, faster and therefore less expensive. And ultimately, if we can bring down the cost, that'll improve access for many, many people. We're also looking at ways that we can do genetic testing and advanced embryo viability non-invasively. And that's important for two reasons. Number one, it does bring down the cost when you don't have to do a biopsy on an embryo or send it to genetic testing. And it also keeps the embryo from having a potentially invasive procedure. So I want to speak about some of our advances in AI and looking at non-invasive embryo viability. But all those things improve outcomes and reduce costs and ultimately get at access, which is really the single biggest issue that our industry faces.
There's an access piece, there's a cost piece, there's a coverage piece. You know, as you look at the landscape kind of around fertility, how do you see that evolving over the next several years?
Yeah, I definitely think that you're going to continue to see provider consolidation. There are quite a few new entrants in the marketplace over the last 6 months to a year, nonetheless 2 years. And so there's a private equity presence. So I do think you'll see continued consolidation. I think you're going to see significant coverage expansion. 21, 22, I think are landmark years as far as employers offering additional benefits and coverage. And we'll see the numbers. It's still early in 22, but several major employers have come out with access and fertility coverage that either didn't have it in the past or they're significantly expanding their coverage. And that has really positive impact on the access issue we talked earlier. So I think that's going to continue each and every year. What that does is it brings access, but it also brings a significant amount of managed care or new benefits administrators into the space versus what was typically a self-pay business. And that adds a new dynamic. I think there'll be more focus on value and how we work together to bundle care so that we can bring value to both payers, employers, and to patients. And then finally, I think there's just going to be a lot of work on kind of this non-invasive AI work on both embryos, but also I think there'll be more and more focus on, sperm testing and get really very granular on what is that, which one of those sperm do we want to inject? And there's more and more testing to make sure that those rates continue to go up. There's been so much focus on the egg and embryo. I think there's going to be a lot more AI and technology that goes around sperm selection as well.
And there's obviously kind of that benchmarking and being able to kind of show the improvement, standardize the processes, and achieve the best outcome for your patients is critical. Have you been able to take that data and have those conversations with payers? Have the payers been receptive and in terms of starting to think through what a value-based reimbursement model might look like with Ovation?
So I think that's a great question. I mean, we're at the start of that, right? I mean, I don't know that that's been done in past in our history, but we are very much have a presentation that we're sharing with payers to talk about our outcomes. Why Ovation? And the answer is because our outcomes are better than our peers around the country and better than averages. And so back to you can spend less dollars and you're going to have happier customers because they're getting a healthy baby faster. So that's positive. So yes, we have really started to have those conversations, but they're in their early stages. Recall it's a small portion of our business today, but it's growing and it's growing rapidly. So I think those conversations are important. Number one, so they understand what Ovation is delivering and the differences we are making across the company and how we differentiate ourselves. But ultimately, how do we work together to deliver value? So I look forward to having those conversations. And I think particularly as we see women's health as a whole start working together and fertility and women's health kind of getting in that spotlight, I think there'll be opportunities to work with payers and patients and employers on delivering the best results at the lowest cost.
You've obviously spent a lot of time on the science piece and do spend a ton of time publishing papers and abstracts. What are some of the most exciting innovations that you're currently working on?
We just released a landmark study in December on the human and embryonic transcription initiation, really looking at how early genes express themselves versus what was previous thought. Dr. Tex Vermillier was instrumental in that study, which really has the ability to rewrite some textbooks. So, and has some long-ranging implications for infertility treatment, epigenetic inheritance, stem cell-derived embryos, and cancer. And then I think the final thing for us is really looking at the future of testing and where do we go with genetic testing? What else can we be doing to ensure that we have healthy embryos that get implanted and the parents know as much as they want to know about their genes and about their embryos. And I think there's just a good amount of work. We have a partnership in that area and want to continue to push the envelope when it comes to being leaders in genetic testing as well.